my name is April Hoge and I'm an MPH student in the Department of Health Behavior. For my internship, I worked with the U.S. Department of Veterans Affairs, commonly referred to as the VA, through the local VA Medical Center here in Birmingham. The VA, which was founded in 1930, serves veterans and their families and draws its motto from President Lincoln's second inaugural address with the quote, "To care for him who shall have borne the battle and for his widow and his orphan." A specific group of veterans that the VA has been catering to more recently is homeless experienced veterans. In 2010, the VA began a new response to veteran homelessness through what are known as Homeless Patient Aligned Care Teams, or HPACs. These HPACs are clinics that, in addition to providing medical care tailored to homeless experienced veterans, act as a networking center for the various housing and social services offered through the different VA medical centers across the U.S. And it's important to note that not all VA medical centers have an HPAC, and not all HPACs operate the same way or have the same range of services offered. My internship focused on understanding what makes an HPAC efficient and effective versus what might create or increase barriers to care and connection to services in an HPAC. I worked alongside a multidisciplinary team to develop an evidence-based survey before personally disseminating that survey across the largest 28 HPACs in the U.S. Previous site visits to HPACs as well as non-VA homeless clinics were conducted by the team. And from these site visits, I collected notes and meeting minutes and went on to code each of these. From these coded notes, our team recognized 13 distinct domains. Those were spanning across, access to services, range of services, patient-centered care, and so on. I personally separated each of those domain notes into digests of relative codes, and these digests were disseminated across our team, myself included, for drafting survey items. And once all of these digests were completed and returned, I organized and led a 2-day retreat in which team members met and discussed each of the drafted survey items. At the end of that retreat, we had created a 50-item evidence-based HPAC organizational survey. Next, I personally called the 28 largest HPACs to gain feedback from various staff members. Using the survey, I interviewed HPAC personnel on those original 13 domains to get their perspective on providing care in an HPAC and how well they believe this national response to veteran homelessness is being implemented on their local levels. I'm excited to say that I've since been offered a full-time position at the Birmingham VA Medical Center, and I can't wait to see this project go on to influence VA and maybe even nationwide homeless healthcare policy.